Well, good morning, everybody, and thank you for joining us today. This is, I think, our sixth Cal and ESM webinar together. I am Joe DeLucchi. I am with Cal Insurance here in San Francisco. We represent businesses, schools and nonprofits, investment real estate groups, and successful families across the United States. And we have partnered with ESM Insight. They are an outstanding organization. We've been partners for over a year, and our clients who have workers' compensation cover through Cal get the benefit of their expertise on the safety and risk management side and also on the claim management side. And so we are joined today by Sinead Scrisopi, who our clients have gotten to know. She's a customer success manager with ESM. And then also today, who's going to be co-presenting with me is Abe Jabon, and he is a senior claims advocate, also an attorney. He's got the JD after his name there. And Abe is very special and unique in the sense that he started out working on the workers' comp claim management side. So he and others within the organization that hold the same role are advocates for Cal clients when it comes to workers' compensation claims. They've been on that other side. They've worked as workers' comp claim adjusters. They speak that same language, and they understand the impact of closing claims as quickly and as legally as possible, and the overall impact to the organization's experience modification factor. So I know that that's not part of our conversation today, but just wanted to give you a little bit of a background as to who they are and how they contribute positively for our clients' experience. So thank you all for joining us today. There will be questions and answers. If you go down to the bottom of your screen, you can see the Q&A button there, also the chat button. We will be monitoring that. Sinead will be monitoring that. As with all of our last 5, now 6th presentation, this is a workers' comp focus. We have a number of materials from past webinars that are on both the Cal website and the ESM website. So Sinead, let's kick it off to the bullet points for today's discussion. Today's discussion is going to focus on the executive order presented by Governor Newsom. And we are also, the Workers' Comp Insurance Rating Bureau, the WCIRB, is for California, but outside of the state, many of the other states are associated with a similar organization called the NCCI. So if you have out-of-state remote employees, or if you have facilities out of state, or you're headquartered out of state, some of this presentation is going to be applicable to your side as well. The labor law varies by state, and so the governor's order is exclusive to California, but some of these recommendations made by the governing bodies are applicable to many, many states outside of California as well. So we're going to learn about COVID claims being covered underneath workers' compensation, who is covered, what your responsibility as employers is, and what employers should be doing to manage their claims. And also, we probably should touch upon reporting to OSHA too, Abe, during this, because that's going to be an important question I know folks will have. And then also, finally, what's the impact of these COVID claims on my experience modification? What's that looking like? And so we're going to talk about what the Workers' Comp Insurance Rating Bureau and the NCCI are recommending. Okay, so let's move on to the next slide, Sinead. And Abe, do you want to alert us as to the executive order?
Yeah, thanks, Joe, and thanks for that great introduction. I just wanted to say that we really appreciate you putting these on and really value our relationship and partnership with Cal. You guys just are a great group, and I know all your insureds are in good hands.
Thank you.
Let's get right into it. I do want to talk about this really important topic. I don't think that the content will take too much more than 30 or 40 minutes. I've gone through it a few times now. I'm getting a lot of the same questions as well, so hopefully by the end, most of your questions will be answered, but as Joe mentioned, feel free to submit any questions. If there's any firm-specific questions that don't apply to everybody, we'll try and keep it general and then respond to you individually after the webinar. So most of you on the line have heard about the executive order now. It's dated 5/6. If you know a little bit about the executive orders, just generally, you know that the governor declared a state of emergency, and the initial executive order had to do with shelter in place, which we've all seen the effects of. What this 5/6 executive order is doing is creating a rebuttable presumption that COVID-19 claims are compensable under workers' comp. And I'll discuss what rebuttable and a presumptive case means. We'll go through the different elements of how that applies.
Right.
But
But hey,
really,
that's
yeah,
such a game
yeah,
changer. That's such a game changer in the sense that before that executive order, the stance was, really up to the employee to be able to prove in some sense that the COVID-19 was a direct result from their job. And now this shifts the whole dynamic and really
right.
presumes that the employee actually had received it. So now the burden is on the employer, which would, to me, be impossible or very, very difficult to prove otherwise.
Yeah, that's a great point. And it's actually something that we've been discussing. I mean, think about it similar to a flu. How do you prove if you do get a flu and you've been working, how do you prove that you didn't get it at work? I mean, possibly you got it from a spouse or somebody in the community, but this, it's not the same standard as a flu and workers' comp, where there's a higher standard where you're exposed to some kind of influenza higher than the general public, right? There's a higher bar, but with COVID, that's not the case now. They're just presuming that it is work related if you meet certain criteria, which I'll go over during the next slide. But this is really broad, Joe. This applies to everybody, not just essential workers. And a lot of people have been saying, oh, well, this isn't going to affect me because I don't have essential workers going to the job. Well, we're seeing the restrictions be lifted now. So of course it's going to apply to essential workers, but really the way to look at it, the easiest way to look at it is that is basically just not covering people that are working from home. So if I happen to get COVID-19 and I haven't been into the office, I'm not going to be covered under this. Even if I go into the office and I wasn't directed to, I have a set of keys. I can run down to the office, but nobody knows I'm there. Again, that's a rare case, but that also wouldn't be covered. I have to be directed to go into work. A lot of the restaurants that are going to start opening over the weekend, those people will be covered. Basically, everyone's going to be covered other than the people working from home.
Yes. Okay.
We can actually pop over to the next slide because I'll talk about the time frame right here. So the date of exposure, we know the orders from 5/6. The governor made it retroactive to March 19th. So again, that's going to cover a lot of the essential workers, people that have been going to work during that time window anyway. And then they're extending it to 7/5. So we have to keep in mind that this is an executive order, so it's temporary in nature. And I know Joe's been looking at the legislation like I have. We've been anticipating some more permanent replacement to this. So we have a few things that are bills currently, but nothing has been made into law yet. So let's talk about what actually needs to happen on the employee side. So Joe talked about this presumption being kind of switched over to the employer. The burden is now on the employer, but in order for that to happen, we have to have a positive test or a diagnosis from a California medical physician that they have COVID-19. Now, if they only have the diagnosis, they have to have a subsequent test within 30 days to prove that they actually have COVID-19. This has to be within a window of 14 days of performing work at the place of employment. So again, not working from home.
Right. Okay. Should we go to the next? Perfect. So this first one here, Abe, is interesting in the sense, and I think we should spend a moment. The insurance carriers only have 30 days to investigate this claim, and that's different than the next little box here, the normal 90 days. Do you want to just take a moment to talk about that?
Yeah, it's interesting, right? So again, they're putting the burden on employers and insurance
Right.
carriers to say they don't want you denying these claims. They really want to have that rebuttable presumption hold up. So the 30 days, I mean, you talked about it already. How difficult is it to prove that something didn't occur at work if you have, let's say, for example, you have a warehouse full of employees that are testing positive for COVID-19. I mean, the bar is so high there. I think you're just going to have you're going to have some COVID-19 claims. We'll talk about the employer responsibilities later.
Okay.
Just making sure you get all the information and the data for the carrier so that they can administer these claims. And if you have any red flags, to be able to push that over to the employer so they can make a compensability determination. Also, one of the major differences, Joe, and I know we discussed this too, that temporary disability is also not automatic now. This is also unprecedented, right? In California, we have a 3-day waiting period before temporary disability kicks in. That's waived under this order for COVID-19 claims. And one of the biggest differences is the sick leave. So there are obviously new sick leave legislation that has gone through for COVID-19, Families First, for example. The employee actually has to exhaust all of that benefit before they're eligible for temporary disability. And the other main difference now is they're putting a little more of the onus on the employee to get recertified every 15 days rather than every 45 days. So I know a lot of the employers in the audience, they are familiar with work status that they'll get, typically every 45 days, whether or not they can accommodate. Obviously with COVID-19, if they have that and they're symptomatic, they're going to not be able to come to work, even if they're asymptomatic and they're still testing positive. You probably don't want those people on the job site. So the doctor will determine when they can return and whether or not they are off work. TTD.
Right, and unprecedented, that's the key word for all of this, because not only with this executive order, but also with the proposed changes from the WCIRB, from the NCCI out of California. These are all unprecedented movements and changes that are happening right now. So let's go on to the next slide so we can learn about you can help me here with this one. What does rebuttable mean, Abe?
Yeah,
What does this mean?
they don't really make it easy to understand. A lot of times the wording is really vague, right? So rebuttable, just in general, once we have this established case, let's say they meet all the criteria that I discussed. They came into work within 14 days with a positive test, or they have a diagnosis from a doctor saying that they have COVID-19. That is their initial burden on the employee. Once that happens, the burden is shifted over to the employer, and now the employer has the chance in 30 days to rebut that presumptive case. So they have a chance to say, okay, I understand that you've met all the criteria, but here's other evidence that proves that this is not work related. What that other evidence is, it would be case by case, obviously. It's really hard to imagine all the different elements that might go into somebody that was able to rebut this presumption. I'm sure those will come down the line. But
it's so difficult. We have a client right now, and ESM is working with the client as well. And they have one case where they have three staff members right now that are active COVID cases, three people in the warehouse. Mm-hmm. And one of them, and this is going to be interesting to see where it goes, one of them said, hey, I found out that, someone that I'm living with, they had COVID, or I guess it happened days before they actually went back to work. And they told their employer that it was, it turned out, my spouse has COVID. And so that might be one example where who knows how that workers' comp claim is going to play out. I mean, even with that, I think still the burden would be toward the employer and workers' comp carrier.
Right. And it's still, even at that point, you kind of have to look at the timeline, right? So if they hadn't been at work at all prior to that,
correct.
Okay, then that's better evidence, right? Because well, they couldn't have contracted it at work. Those are going to be,
but it's hard to say
scenarios that come on.
Right? Yeah, right.
It's hard. You don't know unless you have the definitive timeline. Did they have a positive test before they came back, to work? Then,
And they
even
didn't.
if they
They
have
didn't
that,
in this case. Yeah.
right, and even if they have that, Joe, it's going to be 30 days for the adjuster to not only get them to sign a medical release or subpoena those documents and then deny it timely. I mean, there's just a lot of factors at play. They really just want to
Right.
put this onus on the employer. And it should be mentioned that, even though there are going to be cases, some people are asymptomatic. Some people have really mild cases. So potentially they're just going to exhaust their families first leave and
Right.
have maybe some additional extension of temporary disability, but hopefully most people are just getting discharged. Obviously there's going to be the other cases where death is involved, really unfortunate. I think that a vast majority of the claims that we're going to see are just going to be temporary leaves off work.
Yeah. So Sinead, I think we should go to the two paths now, and Abe, talk about the two paths for the claims.
Yeah, and this is really just to highlight the fact that this is a temporary order. So we don't know yet what legislation will supersede this particular order, but you either have a claim that falls within the window and it has the presumption, or it doesn't, right? So the issue with that is you just want to make sure you don't want to adjust the claim, right? You want to err on the side of caution reporting these types of claims, making sure that you're getting all the information, like Joe mentioned with that other case, to the carrier so that they can make their compensability determination. But you don't have to memorize all these dates. The important thing is to get it to the insurance carrier so that they can make their determination of whether it falls within these windows, whether or not this case has an actual presumption of work relatedness.
So Abe, the employee comes to the employer, says, I've contracted COVID-19. We don't know if it happened, of course, at work or at home or at the grocery store. But the next most important step for the employer to take at that point in time, obviously, send them home is immediate. But
right.
let's talk just for a quick moment about the forms, right? What are the forms that should be given at that point, and how quickly should this ball get rolling as far as reporting to the workers' compensation carrier?
Yeah, well, the standard hasn't changed, right? There's nothing in this order that indicates a heightened standard to hand a DWC-1 form, which is the initial form that you hand to somebody when they're alleging an industrial injury. There's no heightened standard, but the problem is when you're presuming something is work-related, a lot of the carriers now are actually requiring employers that get a positive test or somebody verifies or tells the employer that they have a positive test, they want you to report the claims because they only have 30 days to investigate it.
Right.
And you're probably going to be on the hook if you do have those types of claims. Now, again,
Normally you have the two forms, right? I mean, one that the employer fills out, the second form that the employee and the manager, both fill out the second form. Well, in an instance where, you've sent the form, right, and this person might be in the hospital, they might not be able to complete the second half. But the point is that even if they're not able to complete that second half of the form, right, the employer still wants to get that, as much info as they have at the time, even if it's an incomplete form, off to the workers' compensation carrier.
Yeah, and the form you're talking about is the 5020 form, and so that's
Yes.
the employer's report of injury. And a lot of carriers just have online portals now where you can file a claim and they'll automatically fill out the form. Just the important piece of all of that is just to report it to the carrier timely and get them all the information that's related to that particular employee so that there's no delay in the claim or no issues with the claim.
And what about OSHA, Abe? There's been a big question about that this last week, and there's a lot of ambiguity. I think there was a popular phrase, when this whole happened, out of an abundance of caution. Can you take a moment to speak about, reporting to OSHA a COVID issue? Because if an employee does not end up in the hospital, I don't see that as an OSHA recordable event. But if we go letter of the law and the employee is in the hospital, that should be an OSHA reported event, no?
Yeah, so the OSHA requirements are a little bit different than reporting a claim, let's say, to your workers' compensation carrier.
Right.
OSHA wanted to remove some of the ambiguity by saying, uh, just like you said, out of an abundance of caution, go ahead and report it to us, even if you don't believe that it's work related, because we'll make that determination. And that was partially because so many employers were making a judgment call about, somebody having a heart attack and falling down, and they didn't think that that was necessarily work related or met the criteria for OSHA. So it's better to avoid the fines and just
Right.
err on the side, be cautious, report any
Am I looking at it
potentially.
am I looking at it the wrong way? If an ambulance arrives at the work site or the employee ends up in the hospital, that's kind of a very, very simple way to say, this is an OSHA recordable event. It has to be recorded within a 24-hour period, Abe, correct?
Yeah, and they'll let you know. I mean, they will let you, if you, they're really responsive. So if you call them, let them know what happened, they'll make the determination for you. So that is a very clear-cut case. Yes, that is something that I would report right away and let them make any determination that they need on their end. Make sure that you're dotting all your I's and crossing your T's when it comes to OSHA, because I know that you've seen clients or heard of people and firms that get really big fines if they don't follow the rules on that.
So let's go forward and look at the steps for an employer to take now, Abe. I mean, you were on the other side of the fence. You were a workers' compensation claims adjuster. You were on the front lines. What's important for the employer to know right here?
Well, you have to keep in mind that we're lifting some restrictions. We're kind of not fully aware of what the full extent of COVID-19 is going to be right now in California or really anywhere. And so it's important to keep in touch with the claims handler. Make sure that if you do have any claims, you're making sure that they have all the information that they need, again, because of that shortened window, and any type of background that they might need. You might have a specific claimant that had mentioned that they tested positive prior to coming back to work. I don't know why they would be at work. Potentially the test was delayed, so they
Right.
just found out. But that is obviously material information that the carrier needs to know. Also, the adjusters are going to be inundated with questions and claims, so they might be really busy. You don't want to have your employees be overlooked in any sense, and just make sure that they have all the wage statement information. So it's just smooth sailing, and you can hopefully wrap the claim up as quickly as possible, get them discharged, and then everything's good.
Got it. So maybe we go on to steps for employers to take right now then. So an employee files the claim, the business files the claim with the workers' compensation carrier. And these steps right here are not just exclusive for COVID-19, but really for any workers' compensation claim, correct?
Right. Yeah. The communication is key. I harp on that all the time, especially with this type of case. I mean, just put yourself in the employee's position here. They got a positive test for COVID-19. They're worried about their health. They're worried about spreading it to their family. They're worried about their livelihood. They're not aware, like you and I, about the different types of benefits, the workers' compensation end of it, the fact that Families First Act is there. This is a good time for employer to really build that rapport even more, communicate, that things will be taken care of on the employer end. You can walk them through that process, and that also goes along with speaking with the adjuster. Hey, I spoke with the adjuster. Here's what's happening. Here's when your benefits will kick in. So this is really a way to put people at ease. And
Right.
obviously
The
that's not going to always.
injured worker wants to
Yeah,
know that you care, that you as the employer care, whether it's COVID or any
absolutely.
other workplace related injury. Stay in touch. Let them know you
Right.
care about them. Let them know you care about their health, them getting better. You're looking forward to having them back when the time is right.
I can't tell you how many times I see this with employers that are good at this, and they just have a really low litigation rate.
Right.
It's really highly correlated. If they feel like they are not understanding the process because it's complex, then they might go to an attorney and say, hey, I don't know what's going on here. I need your help. and then the claims just get just messy unnecessarily.
Right,
So
and there's a number of personal injury attorneys out there looking for these sort of cases, right? You fly into LAX, the first 20 billboards you see on the way to the hotel are from law firms asking if you were injured at work. You watch, daytime TV or what have you. The injured employee, they can't get out of, they can't get out of their home. They're there. They're seeing the commercials. Have you been injured? Call us today. So, right, we got to stay in good, proper communication with these employees so that they do feel and they know that we care.
absolutely.
Additional steps. Okay, so now this is important, Abe, about the separate log, and we're going to talk about, well, we have the why right here on this slide as well. So we need to keep a separate log, Abe, of these COVID-19 claims. And the big question why here, so the Workers' Compensation Insurance Bureau, that's specific to California. The NCCI is specific to many, many other states outside of California, but they both have the same proposed language. And the proposed language is that all COVID-19 claims be excluded from the employer's specific experience modification factor. Now, this has to be approved by the state's insurance commissioners. In California, it's Commissioner Lara. And in the hearing for this is going to be July 1 of 2020. Now, what I think, and I don't want to speak for you, but I think you probably feel the same way, you probably believe the same thing, is that the commissioner in California, and these commissioners in out of states, they'd be crazy not to accept this particular recommendation from the WCIRB that just says, hey, it's a COVID-19 claim. We are going to use a separate code for it. I think it's code 0012 on the loss history reporting. And that's going to exclude these claims from the rating calculations. Abe, anything to add to that I might have missed?
Yeah, that goes actually along with the next slide. I couldn't have said it better. I mean, it's exactly what I believe as well. I don't think that there's any reason to believe Commissioner Lawyer is going to reject a unanimous decision by the WCRB. This will almost certainly be approved. Also, just the salary continuation, the office workers that you have working from home, just keep track of all of that payroll information.
Really important, because
Yes.
It starts from when the shelter-in-place order began, and then there's two different rules here that I want. And I know in a previous webinar I went through this, and I think it's really important to repeat. And some people might not have been at the one where we really hammered into these other proposed changes. But proposed change number one is that all of your employees are working from home, or a majority of them are, and they might have been working on the restaurant floor, or working on the retail showroom floor, or doing some sort of construction type job. If they then shifted duties, and this is the first time ever in California, and I think with the NCCI as well, that there is an allowable separation of category here. So time was, before all of this, if you're a restaurant employee, you perform some clerical duties, 100% of the payroll goes into the restaurant employee class code. So this changes. They're working from home. It now goes into the clerical class code for that time period. You got to keep the records. You got to keep the records from shelter in place to X date here. They are only performing clerical duties at home. That salary for that period is going to be shifted into the much lower rate, that clerical rate. Now, some employers are going to say, hey, we have clients that say this as well. We received the PPP loan. We've been paying our employees, but they're not working for me at all. They are sheltering in place. We're paying them. Are we going to get charged workers' compensation costs? And that's not fair. That's not fair to an employer. And so at final audit, there's going to be a new class code that's going to be put. And again, this one's also 0012. And these are all proposed by the WCIRB and the NCCI. But again, I don't see any reason as to why the insurance commissioner or commissioners would not approve these recommendations. And what happens with that is that payroll is not going to be subject to a cost. There won't be a rate attached to it when you've been paying people to shelter in place. So they're on payroll, but they're not doing any work for you whatsoever. Okay? So I think that's all we want to attack right there on this slide. I see a question, Abe. I think maybe this would be a good one because it's generic. If an employee shows up at work and has a temperature over 100.4, and they say they think they have COVID for work, do we give them the DWC-1 and send them to our workers' comp clinic, Abe? I think it's a
Great
great question.
Great question. Yes, absolutely. It, so it sounds like you have the exact right procedure, right? They are alleging a work-related injury, even if we don't know whether or not, one, they have COVID, two, they meet all the criteria for a presumptive case. We want to make sure that they get medical treatment, and that's a great time right there to give them the DWC-1. Obviously, hopefully you have a mask on, or you're adhering to social distancing somehow during that interaction. But absolutely, that is something that you would want to give them a DWC-1 and let your carrier know about it. And if they happen to come back with a negative result, well, then that's a obvious denial, and they wouldn't meet any of the criteria. So either way, you're fine.
Thank you. Let's forward, unless there was anything more there. The 4 proposed bills in the legislature, Abe.
Yeah, yeah, and actually, since then, there's been a host of other bills coming through. Now, it's important not to get hung up on which potential bill will get approved. I don't want to go into the bills specifically, just because they're not law yet. But you can see some of the proposals will give you an idea of what may replace the executive order down the line. They want to create a rebuttable presumption for people that are in hospitals or critical workers, firefighters, peace officers, things of that nature. So it's something that we'll keep in mind and we'll continue to monitor. But once they become law or something supersedes this, obviously that's going to be another webinar.
Yes. Should we go on to the reopening requirements then, as per the governor?
Right, and this one of the things that you'll notice with a lot of these COVID-19 requirements and reopening requirements is that they're constantly changing. So it's good to go to the source, right? The governor has his reopening requirements, and some of which have already changed. So we'll see this, especially now that the reopening requirements are being implemented by some businesses. You're going to see some restaurants opening over the weekend with some limitation. So this is constantly changing. We have the resources here, some of the links, but you're going to have things that range from performing a detailed risk assessment to disinfectant protocols, implementing physical distance. A lot of these things we've heard of, but there's going to be specific requirements depending on the type of business. So it's important to monitor, it's important to keep track of, and we have the resources here for you as well.
Yes. Speaking of resources, let's go to that next, the next and the second to final slide here. So we've had, and again, I think this is probably the 6th webinar, Cal and ESM together, from the beginning of the exposure control plan. That was phase 1, the remote work program, the return to work program, and then there were various webinars we did with Dan, and the last one, of course, was a 2-parter just due to the size and complexity of it. But all of these materials, whether you were able to make all 6 of these, whether you were able to only make today's, doesn't make a difference. You go to the Cal website, www.mycalteam.com. Right in the front page, there's a little banner about COVID-19. You click on that. All of our past recordings, and even more importantly, all of the past training materials that you can download for your business, whether it be the work from home ergo plan, the exposure control plan, safety meeting programs, they're all there. Return to work program, it's all there. And it's also on the ESM website too. You go to www.esminsight.com/COVID Compliance Center. All of our materials are joint, they're uniform, so you can find them on either site. Really doesn't make a difference, but it's there for you. It's there for you to take advantage of. It's there for your compliance. So Abe, any other final words of wisdom before we come to a close here?
No, this is really comprehensive. I know Cal and ESM have been working nonstop on COVID related material since the beginning. So we really have a comprehensive library of how to handle this, how to handle working from home or reopening your business. So if there's anything that's confusing, feel free to reach out to your resources, and we're here to help. So I
We're here
appreciate
to
it, Joe.
help. Absolutely. We're here to help. We want to thank Abe and Sinead for being here today, for their words of wisdom. Abe, really appreciate it. I want to thank you, the employers, the participants that are on this webinar today. Thank you for joining us. I hope you got something out of this today. With that, I wish you a happy Friday, a great Memorial Day weekend. Take care. Be safe. Thank you.